So coming to your DM images, all from Philips. You all know this is regarding a liquid solid interface. The angle which is formed, firstly the angle is formed within the drop which is measured. Okay, the tangent is dropped and then you measure it. It is regarding the wetting. 0 degree perfect wetting, less than 90 degree good wetting, more than 90 degree bad wetting, 180 degree no wetting. You can remember for this is similar to polyether is similar to addition silicon, condensation silicon. Okay, then this graph of Bingham liquids is very important, right? Stress versus strain rate. Please see the x and the y axis. Straight line is Newtonian, line below Newtonian is pseudoplastic, line above is dilated, that is the material will increase in viscosity. The slope will give you viscosity. Plastic, higher viscosity materials require certain push, that is certain stress, certain force to start flowing, and then they behave like straight line or Newtonian. This is typical for Munsell color system. This image has come 2-3 times in last 7 years. The central Z axis represents value. Okay, central Z axis represents value. Okay, value increases from bottom to top. Bottom is 0, this is highest, this is black, this is white, right? Two bodies compressing a liquid, but the arrows shown are left to right. This is calculating tension basically. This is diametral tensile strength. Diametral tensile strength. Okay, this you all know regarding the hardness test. Brinell, round cross section, circular cross section of the indentation is found, spherical, hemispherical, ball. Vickers, diamond shape indenter will form a square. Noob, again diamond with two angles 130 and 172 will form rhomboid. You multiply the diagonals and you get the area. Rockwell will have no such indentation shape. If it is not showing Dr. Divyani any error, it means it is correct. I checked on my portal as well. Okay, in the end, just remind me, I'll show you how it shows in my portal. Maybe that is the same everywhere. This image is typical in Philips, right? This is in all the images are from Philips. This is nothing but amalgam tattoo. They can ask you about amalgam complications and all. Okay, this image is again from Philips. They show you a gold crown and they show you some patch type lesion. This is not galvanism. Okay, one crown will not create galvanism, you all know from the theory. This is some allergic reaction, and this is where most of the students will make some mistake, right? Allergic reaction. This is, there are 3 methods of dispensing elastomers: mixing, hand mixing, static auto mixing, and dynamic mechanical mixing. This is static mechanical mixing. Okay, The light body, it is majorly used for light body material. You get a gun, you put a cartridge and you press it. The material flows in between these striations. They are in the form of one S like this, and then one S like this, one straight S, one reverse S, and the material flows in between them, right? Yeah, you can say lichenoid, it's a chemical reaction, allergic reaction. This is dynamic mechanical mix, static auto mixing, static auto mixing and dynamic mechanical mixing. The name of the machine 3M company has been asked. Pentamix. Another question which came regarding Pentamix, this is a machine which is going to mix the material. The material is in the form of this cartridge. Okay, the bigger portion has base, this has a catalyst. The thinner portion, I have this in my clinic for more than a decade. Okay, material which you are going to mix here is regular body. What you are going to get is monophase impression usually with regular body, but you can use light body as well in this, right? It motorized machine, it will mix and the material will come out. You directly put a tray underneath it, but that is also an art. Okay, you have to move the tray all over so that the material is uniformly distributed, and then you make the impression. Important question is, they have given you the name dynamic mechanical mixing. You have to remember, I'll write it neatly. Dynamic mechanical, this is a device of dynamic mechanical mixing. The name is Pentamix. Now many machines are there. Another question which came was, Pentamix can be used for which two materials? One is addition silicon primarily and second is polyether. You have to remember this, polyether. Easy to remember is, these are the only two materials we are using in today's dentistry because they are the accurate ones. Okay, polyether is the material of choice for implants because of high TS strength and true hydrophilic nature. Addition silicon is the most accurate one, so it is the best one. Okay, this is agar. This will not be shown, definitely the name. You have 3 compartments, you have to liquefy it, store it, tempering is there, lot of procedures. This is agar. Agar and alginate, I have told you, they are important. Okay, everything, composition, each and every ingredient ka role in agar and alginate is important. Now this is related to casting. They can ask you, I'll show you, like they can ask you anything. This is water, this is sprue, this is reservoir. Okay, what should be the gap, minimum distance between the two crowns? It is 3 millimeters. Two wax patterns actually, right? So these are there. Then this is regarding the casting. You have binder and silica. 4 types are used. This is a thermal expansion versus temperature. As the temperature increases, the order, we have been rectifying this since long, CQTF. Dr. Khushi, for flabby ridges we use mucostatic. We have discussed in prosto. अभी तो पहले ये पढ़ लो, CQTF. Cristobalite will expand more than quartz, then tridymite, and then fused quartz. Patients usually have flabby ridge where? In combination syndrome, also called as Kelly syndrome. Okay, anterior teeth, maxilla are missing, lower teeth are there, they keep on impinging, the tissue becomes fibrotic, then flabby, it's like hanging. What we do is, we make a primary impression, then we make a special tray In that special tray we cut a window. Okay, the portion where the flabby tissue is. This part, which is normal, is taken in the normal materials. But the window portion, that is called window technique impression. Okay, window part is basically taken in through the mucostatic material like plaster of Paris, gypsum. This is an image in the. Acha, now I know why this is coming. Okay. This is a localized shrinkage porosity. See the angulation, the tapering of the sprue is seen. Okay, I'm sorry. The thickness of the sprue is not correct. So this is a typical image. The part of the crown is not being made. So it is localized shrinkage porosity. Right? This is tapering. The treatment is flare. This is suck back porosity. Dr. Anvesha, if you have to choose between AS and PE, better go with PE as per the books. Okay. Still, I'll confirm it from Dhruv sir. See, the things are changing on very fast pace in implant world, but the catch is the question is related to prosto or DM. We have to see on that aspect. I'll just confirm it and still get back on that. Still, which part of type of screw is best, wax or hollow metal? Wax are mostly used because of burnout parameter, right? This is a porosity seen on the intaglio portion. Or the cavity portion of the casting. Only porosity which is on the intaglio portion.
Last. इसकी last आपने खाई है?
This is back pressure porosity. Just one second. Back pressure porosity. Rounded and shiny surface. Rounded and shiny surface because of incomplete wax elimination. Etching pattern, we have type 1, 2, 3 majorly. Type 1, you dissolve the core but rods, the periphery is intact. The core is dissolved but the periphery is intact, giving a honeycomb appearance. It's type 1, it is the desired one. Type 2, it's cobblestone appearance. Type 3 is pitted enamel, map like appearance. Map like, irregular map like appearance. Okay. Then etching generations, 3-step generations. Conditioner को ना etchant लिख लो. Okay, this is an image from book only. 3-step, when etchant is separate and you have 2 more primer and adhesive separately, this is your 4th generation. Okay, these 2 are total etch, these are self etch. 4th and 5th, 4th, 5, 6, 7. 5th is etchant is again separate. In total etch, I have told you etchant is separate. Primer and bond will be together. Okay, it is two step. Sixth generation, etchant is combined with primer. We have again two step. Seventh generation, all in one generation, single bottle. Right? Bond strength, 4 more than 5 more than 6 is equal to 7. Highest bond strength is with fourth. Dr. Ved, nobody can say eligibility. अगर आप increase कर भी दिया तो like they have to give you a lot of time to fill up forms and all. I don't think so. Okay, या तो पूरा एग्जाम उठा के पुश कर देंगे या फिर nothing will happen. Either ways. Right? This is a typical diagram of layering technique or incremental technique. Layering technique or incremental technique in composites. Right? This is a diagram of zinc phosphate cement manipulation, string test or rope test to increase setting time. They can ask you questions on how do you increase setting time most commonly. Dr. Kabir, please don't ask such questions at this stage. Etchant is washed off, primer and bond stay in the tooth. Please read your notes once. Okay. If this string test or rope test 12 to 19 millimeter, this string should be 12 to 19 millimeters. Either ways, if it is less than 12 or more than 19, you discard the cement. You discard the cement. A cement which has calcium, carboxylic acids, aluminium and a lot of other things is GIC. The main ingredients will include mnemonic like SCAF, silica, calcium, aluminium, fluoride. Okay. After reactions, everything gets converted to aluminium salts. These are the brand names of compomers. Compomers are a stage between, you can say, GIC and composite. They are also called as polyacid modified composites. Composites which have incorporation of polyacid for enhancing the reactions. Okay, the addition reaction. But overall the strength is low. When you talk about the strength, remember GIC is less than RMGIC is less than compomer is less than composite. When it comes to fluoride release, GIC is equal to RMGIC more than compomer more than composite. Okay. Temporary cements, temposils are all usually zinc oxide eugenol based cement to be used for temporary purposes in dentistry. This is a classical phase diagram of gamma 1, gamma 2. This green portion is mercury of amalgam, the crystal growth reaction. Gamma 1 is so many, gamma 1 acting as a matrix. Dr. Jayashri, in both the case, it will cause narrow sprue. You have a dense alloy, but your sprue thickness is less. It will cause localized shrinkage porosity. Or you have a dense alloy, plus you are not using reservoir because you have a dense alloy for casting. So it might also cause localized shrinkage porosity. You have to mark both. There is no one answer for this. A typical diagram of under trituration, and this is normal trituration. Normal one will form a ball, right? It will form a ball and it will have a convex outer surface. convex outer surface, and when you drop it from certain height like 10 to 15 centimeters, it will not break. Okay, this is, they can ask you the torch flame, the combustion zone of combustion is what, reducing zone which is used what, torch flame for burning the alloy, right? This is injection molding technique to push the acrylic resin for making of dentures. This is like sprue only. This is the best technique, minimum errors or porosities, most accurate technique for loading of denture base. This is fluid resin technique. This is the worst one, worst technique, because after this there are very high chances the teeth show movement. Okay, the teeth is movement. Okay, Dr. Ayush, please show that question. And see, as such long term तो नहीं होगा ना, long term में तो you will not use zinc oxide eugenol. You either use GIC or you use phosphate. If you have to choose either of two, phosphate is better because phosphate will not bind chemically with the tooth. Okay, this is crazing of denture base resins. White lines on pink denture, okay, or zigs like these patterns you can see. Crazing cracks. Blade implants, blade form implants, blade shape implants. Transalveolar. Trans means through and through the mandible, engaging the upper and the lower border both. This is regarding the MISH classification D1, D2, D3, D4. I have given you the notes on implants in your app. Please read those 5-7 pages. They are very, very, very important. Every year now, in number of questions on implants are increasing because they're asking from DM, prosto, perio, OS point of view. Okay. Then the waxes. Okay, waxes, these are not green sticks, these are waxes, right? This is casting wax used for making a casting framework. This is boxing wax, making a boxing out of it. This is which wax? Anyone remembers? Porosities, we can summarize like one session I have to take for a few questions. That time I'll do. Okay. Inlay wax, yeah. This is beading wax. Beading से क्या होगा? You will be able to appreciate, or the word is accentuate, the sulcus on cast. Accentuate the sulcus on the cast so that you can make special tray. This yellow color, typical, not yellow but typical sir, is sticky wax. Remember, sticky wax is to not stick the fragments, it will just bind the fragments. Stick, you will join the fragments of broken denture or castings. Okay, you will just stabilize the term. Remember, it will just stabilize the fragments, but actually the sticking thing will be the denture base, acrylic material, not the wax. Okay, then this is healing abutment also called as gingival former. सेकेंड स्टेज सर्जरी में यूज़ होता है. सेकेंड स्टेज सर्जरी ऑफ इम्प्लांट, you place it for usually 7 days or 1 week. It gives the shape to the gingiva. Remember, the implant you are placing in the bone, the crown is going to come on this implant coming through the gingiva, which is going to be shaped up like this. So it creates what? It helps create the beautiful emergence profile for the prosthesis, implant prosthesis. Okay.